Okay. Hi, everyone. This is Jessica Pirro with Crisis Services, and we're bringing you another edition of our Crisis Services behind the scenes during the COVID-19 crisis. So I'm excited to have with me today Meghan. Meghan's one of our outreach counselors in our mobile outreach program here at Crisis Services. So Meghan, thank you so much for spending some time with me today and kind of sharing your voice and the experience of everything that's been going on. So I'm glad you're doing well, and it's good to see you.
Of course. Thank you for having me. Always good to see you.
To see you. So I think the first question really just to dive into is just how are you adapting to remote work? Because this is something that your whole department has had to shift to pretty quickly. And I'm just curious how you're adapting. How's that been for you and your colleagues?
So it's definitely different. Obviously, this whole experience is different. Nobody woke up thinking they were going to live through a pandemic, but here we are.
Yes.
I think our department as a whole, as outreach, we've done it. We've made the transition very smoothly, and there's a little bump here and there, but it's nothing we can't handle, and we're getting through, and we haven't stopped working. I want to make that clear. We're always going to be available. We are here for you no matter what, and it's never going to stop, even during a pandemic. So the transition has definitely been a little bizarre and definitely weird, to say the least, but it's been fairly easy, and we're doing it. And I think working from home, it sounds a little scary but also nice, like a little vacation, but we're doing the same things we would do in the office as any other day. So we're not stopping. Like I said, we're still going out into the field and completing mental health evaluations. We're answering your calls no matter what's going on, and it is 24/7.
Yeah, you guys haven't missed a beat, and it's been a lot of creative determination and just real teamwork to kind of adapt to how to make it work for you guys, how to keep the communication flowing day in and day out, because there's so many moving parts with how you manage your cases. So it's been really amazing to watch your team work through that and keep the services as seamless as you can during such an uncertain time. So I want to thank you and your team for everything you've done. It's been amazing. Can you just share with us a little bit of what you're seeing? So kind of signs, symptoms of distress that maybe you're seeing in cases a little differently than maybe before. I'm just curious kind of what you've been seeing over the last couple months.
Yeah, absolutely. So as far as the last couple months and a difference, I've noticed a lot of people or newer people reaching out, people who have never really experienced mental health stress before and are kind of feeling a little out of the ordinary, uncomfortable with it. They don't really know what's going on, what they feel not normal, if you will. And so I just want to really normalize the feelings that everyone's been having lately because of COVID. So obviously nobody, like I said earlier, nobody expects to live through a pandemic. And this pandemic in general is just really shaking things up for everyone, because it's not a situation we have any control over, and it's not a situation we know when it's going to end.
Right.
And so when faced with new situations like having to stay inside, having, to not make contact with certain people all the time, not, maybe you feel more isolated because you can't see your family, you can't see your friends, and that's really your support system. So a lot of people are experiencing new feelings with that. And I want to make it clear for people to not be scared of those feelings, because that's completely normal, especially given the circumstances. Now, what we can do is kind of familiarize people and educate people on what they can do when feeling these things. So some of these new feelings are a lot to do with anxiety behind COVID itself. Do I have it? What's going to happen to my family? When can I get out? Am I going to have a job? All these, I call them a million little stressors, because out of, we have everyday, day-to-day stressors that, we get through, but this is just like a handful of stressors all at once, just because of a simple illness. So we want to normalize that. it's going to happen. You're going to have those feelings behind it of, oh my gosh, I feel so much pressure to do something. I feel so much pressure that I'm not doing something. And that's okay. Everything you're doing is okay. What you need to do for yourself is what you need to do. And whether that's finding new ways to cope with stress, finding new ways to reach out to people, that can happen. And what I want to make clear is that coping skills are great utilization right now because we need to find some way to get through the anxiety. And some of those coping skills might be simply going for a walk when the weather's nice, of course, 6 feet apart, making sure you're distancing, or reaching out over the phone, a simple phone call, FaceTime, Zoom calls, anything you can do to make that contact with the support system you have in your life. Now, if those things don't tend to work or don't calm you down in that moment, you can always utilize the hotline. You can always call our number, which is 834-3131, and you can always ask to speak with my department, which is outreach. We will be there to support you through these feelings and help you understand what might be going on, what you might be feeling, and why you might be feeling it. And we'll always be there for 24/7 support.
Great. Yeah. And I think that's the messages that you're stating is normalizing and understanding that it is expected to feel this way. It's not, that it isn't unusual for a particular individual. So I do think that's very helpful. And sometimes just hearing that from somebody else can put us at ease to know, yeah, how I'm feeling right now is to be expected, and it's okay. But then know that there's support and services like crisis services and the services of mobile outreach, that might be needed, depending on the level of stress that you're managing. So now, I know sometimes it can be hard for us as individuals to reach out for help,
Mhm.
but friends and family, right? So they might be starting to see some concerns with somebody based on the interactions or maybe lack of interaction at this time. What supports or I guess how do families maybe reach out, or what are some tips you could share for families who might have some concerns for a loved one at this time?
Yeah, absolutely. So being in a house, you can't leave the house. You're going to be surrounded by your family members a lot more than usual. And you might be noticing some changes one particular family member's going through. So some of these changes that are of concern that you should reach out to us if you find that you see it through them they're going to be withdrawn. So they're not really going to be active with you. They're not going to socialize with you. They're going to kind of shy away from any type of conversations, or whether that's usually you guys sit down at breakfast, they're not joining breakfast, and that's a concern. That's different behavior. Especially in personality changes. Let's say they're usually very happy, they're social, they want to do things with the family, they want to do things like they want to go outside, they want to change it up. If all of the sudden all they want to do is either stay in bed, or let's say they get really angry now, or let's say they're crying all the time, those are some signs and symptoms that you want to sit down with them and say, hey, are you doing okay? Or hey, how can I help you? And if the becomes where you can't reach out to them, or you can't speak to them, or you're not comfortable even, that's when I want you to give us a call, because we can help you through that and we can actually do the reaching out. It's just simple little minor changes. Let's say they're not sleeping anymore, or their appetite has changed drastically. That's something to be concerned about, and that's something we want you to reach out to us for.
Absolutely, absolutely. And I think, one of the things that we're kind of keeping our eyes on is just the compounding stress and how that's going to then have a ripple effect on mental health safety of our community, and our individuals in our community. So I know as an agency, we are a suicide prevention agency, and the different layers of service from the hotline to the teams that you serve on are there to help provide that intervention and support. And that can be scary once people start to see some of those signs and symptoms that might lead to somebody who might be having thoughts of suicide, or start to talk about death. So can you just share a little bit about maybe what family members could be listening for, maybe in statements that might be a higher level concern for crisis risk? And also then what can they do to approach that conversation with them?
Yeah, absolutely. So some statements that kind of stick out, especially with family members that might seem out of the ordinary, are just, I don't feel like myself anymore, or I don't want to do any of this. I have no motivation. I don't feel good. I'm tired. I'm depressed. I want to hurt myself. I don't want to be here anymore. Just kind of that common ground of not really being present, not really wanting to be present, or, you know, just seem very sad a lot more than usual. Those are kind of, it's when the light bulb wants to go on of, hey, maybe there is something more serious going on. And all I can say for family members is, a lot of people are very hesitant to have the discussion. Are you trying to hurt yourself? Do you want to kill yourself? Those questions are very, it's almost like you want to tiptoe around the situation. But time and time again, it proves that if you just simply ask the question, a conversation will start, because that will trigger them to say, oh, wow, I have somebody's support. Somebody wants to listen to me. Somebody's here to help me. And if, again, you're not comfortable with those statements or questions to ask them, you can always call us. I mean, that's when we'll step in. We'll assess their safety, make sure that they're going to be safe, and we'll help out in any way we can, whether that's making a counseling referral or anything further. We will help out as best we can. But don't be afraid to ask somebody, especially your loved ones who seem withdrawn and different. Don't be afraid to start the conversation, because honestly, 9 times out of 10, that's what they're looking for.
Right, right. And I think that that is an important message of working through our own uncomfortableness to help somebody else find some safety and support. And that's a hard space sometimes to be in, but when somebody reaches out, that it's almost a relief for that other person to say, oh, I can talk about this. I can release this that I've been managing myself for so long. So it is encouraging to for family and friends to really think about that when they're faced with that. So that I appreciate those messages that you're sharing. And I think what's important too for the community to understand about mobile outreach is that you are a diversion program, in the sense that, a lot of times people think if they call, they're concerned about getting taken right to the hospital. And there's so much more work that you guys do with friends and family and the individual who's in crisis before you even make that decision or have to make that decision about taking an individual to the hospital. So it's just a message I wanted to share, because I think sometimes that can be the scary point of making the call to us. So I think, is there things that you see with families when they call that you can quickly kind of put them at ease about that, as you talk with them about the services?
Yeah, and I really appreciate the fact that you brought that up, because so many people are so afraid to reach out to us because they think all we're doing is trying to get to the hospital.
Right.
That's not what we're trying to do. Our number one goal is hospital diversion. We don't want you to go there if you don't need to be there. We want to find out every type of possibility and safety plan and measures to keep you in the community, keep you at home where you're comfortable, keep you with friends and family where it's safe and comfortable for you, where you will succeed in kind of moving towards healing yourself. So when family members, friends, whoever may give us a call, when they're kind of nervous on the other end saying, I don't want them to go to the hospital, I don't want them, please don't do that. I simply just explain our services and let them know, like, I completely, your fear is rational right now. Completely understand that. But our goal and our number one, the whole idea behind our program is hospital diversion.
Right.
And we will do anything and everything, whether it's making a counseling referral, safety planning, whether that means, you stay with a friend tonight, you stay with a family member. We take, means and access away from you. We give them to different family members, a different house, whatever it may be. We're going to come up with the best safety plan for you always.
Yeah, that's great. Yeah. And I think it's just an important message. I know that's a fear, and it's understandable, but for us to
Mhm.
be able to share kind of what the other side looks like when you make that call is really an important message, especially every day. It's an important message, but right now, knowing that we're anticipating more people to maybe need more help than before this pandemic, I think it's important for us to make sure that we're providing that understanding for people in our community. So as you've been adapting the last couple months, is there anything you're seeing differently for yourself personally or professionally with your role or the agency and services? Like, is there anything that's been different for you or you've kind of reflected on a little differently with this experience?
So, as far as my role in the position, we haven't changed the way we work. We haven't changed the way we help people. So, I again want to enforce that we're not doing anything different for you guys, the community. We want to help you in the same ways. As far as like differences I've noticed, it's just simply having to wear a mask and staying 6 feet apart. That's bizarre to me. We don't do that. We want to help you. We want to, make sure that we're a safe place to talk to. And so it's definitely a little different having to show up with a mask. I somewhat feel like a doctor sometimes, but that's really the only difference that I've noticed is, like I said, we're still keeping on with our position and our jobs and our roles in the community, and we're going to help you in any way possible.
Yeah, yeah. I know that's definitely a different feel for you guys because you are trying to build that rapport and engagement, and
Mhm.
it's a little hard to do that when everybody's masked up, you know.
Right, right. It's
But
very different.
yeah, it is different. It is different. So, is there any other last messages that you want to share out to the community this time on behalf of our mission?
Yeah, I just want to tell everyone you're all doing a wonderful job. Everyone is doing a great job, and to remain safe, and we will get through this. There will be an end to this. I don't have that answer of when, but it will. And we're in it all together. We're all going through the same things, feeling the same things, experiencing the same things. And yours is no better than others. Everyone is feeling the same things, okay? So we're here for you. It's going to be okay. Stay safe, 6 feet apart, and wear a mask if you can.
Yes, absolutely. Very good tips. Encouragement and tips. I think that's a great way to end our conversation. So I just want to thank you, Meghan, so much for all that you do for crisis services and the clients in the community. You've been an amazing asset to our organization, and I appreciate your passion and wanting to share the message of your department and services because I think that's really important to make sure the community hears that directly from those that are doing the work day in and day out. So thank you so much for joining me for this behind the scenes at Crisis Services. And as Meghan's shared, it is important to know we're here. So our hotline is 834-3131. We're here 24/7. The staff haven't stopped. They're doing an amazing job. They're taking care of themselves and taking care of each other to be able to take care of the community. So call us, lean on us, know that we're here for you during this time. So thanks again, Meghan. It was so good to see you.
Of course. Thank you so much. Bye, everyone.